Hello, good morning. My name is Violet. Today I'm going to be telling ourselves how to do GCS in an Osce exam in this pandemic. But before I do that, I want to give out a shout out to all my friends. I want to say thank you, Francis, thank you, CG, thank you, Amina, and thank you, Victory. So guys, before you start, you'll be given 5 complete minutes to read your patient's scenario. So read it well, digest it, and understand it. After which you will just be given dicks. After doing this, then you will be given what to chart in it. So watch me as I continue, and don't forget to subscribe to my channel just to encourage me to do more videos. So thank you very much, guys. So let's get started. I approach my scene. I see my scene is safe to approach. I provide privacy for my patients, and I do my hand hygiene according to WHO method, palm to palm. Right palm over left bosom, vice versa, fingers into lace, fingers into locks, fingers into lock, rotation of the form, tips to the finger, and the wrist. So my hands are clean. I can now approach my patient. Hello, darling.
Hi.
My name is Violet. I'm one of the nurses looking after you. Please, could you tell me your full name, please?
I'm Haley Brooke.
And your date of birth, please?
15th February 1970.
Alright, as I saw with the paperwork on my hand, I can confirm I have the right patient. Hallie, please, do you mind if I double check with your wristband, please?
Sure.
Alright, Hallie Brooks, date of birth 15 February 1917, hospital number 10010. Hallie, please can you confirm to me if you have any allergy to food, drug, latex, or adhesive, please?
I'm allergic to codeine.
Oh, what happened when you take codeine, darling?
A skin rash.
Oh, skin rash. Anyway, Ali, that's why you're wearing a red allergic band, okay? Every one of us on the team, we won't give you anything containing codeine, okay?
Sure.
Ali, I see your glasses and your hearing aids on the table. Do you need that?
Yeah, I need those.
Alright, so take your glass and put on your hearing aids, okay?
Thank you.
Alright, Ali, the reason I'm here this morning is because I want to do some set of observations on you, okay? What happened that brought you to the hospital?
Am I in the hospital?
Yes, you're in the hospital, darling. What happened?
I don't know. I think I fell.
Oh, you fell. What were you doing when you fell, darling?
I was getting down the stairs.
Oh my God, so sorry, darling. Are you having any pain?
I'm having headache.
Oh, all right, Hallie. Should I ask you to rate your pain, 0 being the least and 10 being the highest, Hallie? What would you score, darling?
I think it's fine.
Oh, that's quite high, Hallie. Hallie, can I plead with you to manage? When we're done with the set of observation I'm here to do for you, I'll just check your drug charts, and if there's no medication, I'll just give a shout to the doctor so that they prescribe one for you. Can you do that for me, Hallie?
Yeah, sure.
All right, Hallie. So I'm here to do some observations on you. Is this a convenient time, Hallie?
It is.
You don't need to use the washroom?
No.
All right, beautiful, Hallie. Hallie, I'll be giving you the call bell, okay? While I go and assemble my equipment, if that's all right by you, darling.
Okay.
All right, darling. So I do my hand hygiene. After doing my hand hygiene, I'll put on my apron and I'll put on my gloves and I'll go back to my patient. Assessor, please can you confirm all my equipment are well calibrated and ready for use?
Yes.
All right. Hallie,
Yeah.
can you see and hear me clearly, darling?
Yes, I think so.
All right, so that's beautiful. Hallie, do you know where you are, darling?
Am I in the nightclub?
Oh, Hallie, darling, you're not on the nightclub. You are in the hospital, darling. And you know what time of the day it is?
No. Is it dark or morning?
Okay, Hallie, can you look through the window? We are in the morning.
Oh, great.
Yes, and you are in the hospital. Hallie, could you tell me the dates and the months?
I don't know. Is it January?
Oh, Hallie, we are in November, darling. And we're getting ready for our Christmas, you know, Hallie.
Yeah.
All right, darling, don't worry, okay? That's why you are here, darling, okay? Hallie, can you pop out your tongue for me?
Yeah,
please?
sure.
All right, Hallie. Okay, that's beautiful. Hallie, I'll just give you my hand. I want you to hold my hand for me, and I'll try to push on you. Just try to resist me, Hallie. Is that all right, Hallie?
That's okay.
All right, Hallie. Can you hold my hand now?
Yes.
All right, I'll be pushing on you. Try to resist me, darling.
Mm-hmm.
All right, Hallie. That's beautiful, okay? Hallie, can I do that to your hand if you don't mind? The other
Sure.
one. All right, can you hold my hand, please?
Yeah.
All right, I'll be pushing back on you. Just try to resist me if you don't mind, darling. All right, that's beautiful. So, Hallie, I'll just do that on your legs, okay? All right, darling. So, Hallie, I'm holding your legs. Try to resist me.
Okay.
All right, beautiful. I'm holding the next one. Try to resist me. All right. So, Hallie, that's beautiful, okay? All right, Hallie. I'll just chat and get back to you, okay? Hallie, before I do that, can you remove your glass for me, please?
Yeah, sure.
All right, darling, I'll just clip your glass for you, okay? Hallie, I will use one of my hand and I will cover one of your eyes and I will shine a torch on it, okay? I just want to check if it will dilate or react. Hope you don't mind.
I don't
But
mind.
before I do that, I just want to check your eyes, okay? All right, I can see the size of your pupils, okay? That's beautiful. So, Hallie, I'm going to be using one of my hands to close this while I put my torch through this eye. All right, Hallie. All right, sorry, I'll just do the same to the other eyes while I put my torch. Okay, Hallie. All right, darling Hallie. All right, Hallie, I'll just chat and get back to you, okay? But before I do that, Hallie, can I quickly do your blood pressure?
Sure, you can.
All right, but I'll just take off those gloves and apron and put on a new one, okay? I put off my glove and apron in clinical waste, do my hand hygiene, put on a new apron and a glove and go back to the patient. I said, so could you confirm my equipment are well calibrated and ready for use?
Sure.
All right, Hallie, can you confirm to me this your left hand? You've never had any surgery, please?
No.
Because I see there's no inflammation. I'm happy to use it, Hallie. All right, I'll tie a cuff 2 to 3 centimeters away from your cubicle fossa. All right, you'll face something, but don't worry, it will just go off, okay? All right, Hallie, now just count your pulse for 2 minutes, okay? I'll put my 2 fingers on your radiatory and I'll just count the pulse for 2 minutes. For a reset, I'll be counting for 1 minute and respiration for 1 minute. All right, darling. Hallie, can I check your ear, please?
Oh, sure.
I'll just remove your hearing aids, darling, okay?
Okay.
All right. I see there is no discharge from the ear. I'm happy to use the ear. So I just put my tympanic thermometer. All right, that's right. Hallie, can I check your fingernails?
Yeah.
All right, Hallie, I see there is no false nails and I see there's no nail polish, okay? I'll just quickly do a capillary review, okay? I do my capillary review, I see it's less than 2 seconds, so I'm happy to put my probe and get my reading. All right, Hallie, I'm done with the assessment, darling. I'll just chat up and get back to you. Okay, don't mind, darling.
I don't.
All right, I dispose my glove and apron in the clinical waste. I do my hand hygiene, then I'll chat. Endeavor to write the patient's name. The patient's name is Ali Brooks. You've been given a chart. The chart is on the table. The hospital number. Endeavor to write very correctly the date and the time. Then for the eye opening, they say it's spontaneous. Make sure you put the time here. So since it's spontaneous, the patient is having a thought of 4. You could either write 4 here or you tick. And they said the patient is confused. So confused is 4. You could write 4 here or you put C. And the patient, they say the patient obeys command. So you could write 6 here or you can tick. Then for the BP, they say it's 130/80. Be careful not to write it above 130. This is how I do mine. You could also do it differently. And for the size, they gave us the size to be 3. So write 3 here. And the reaction, they say, is positive. So write 4 here. Both is 3 and 4. Then for the power, they say normal power for arms and legs. Some people will write left and right. Some people will just tick. So do the one you wish. And the oxygen saturation, they gave us 98. So guys, what else are we not doing? The temperature is 37. Remember to do it rightly. So temperature, you can just put a tick here and write 37, or you can just do that alone. And they said our pulse is 90. Remember to put a dot for the pulse. I usually write 90 on top. You can just put a dot. BP. So I think we've done all we need to do. Then the next thing is to calculate your GCS score. 6 plus 4 is 10 and 10 plus 4 is 14. So our patient is having a total GCS score for 10. All right, I'll do my hand hygiene and I'll go back to the patient. Hallie.
Hey.
I'm back.
Okay.
All right, Hallie. So, Hallie, you're having a total score of 14, a GCS score of 14, okay?
Okay.
So that means I'll be monitoring you according to our trust policy, okay? Or according to NICE. But if it's according to my trust policy, we'll be monitoring you every 15 minutes until you get a GCS score of 15. Hope you don't mind, darling.
I don't mind.
All right, so that's beautiful. Hallie, I'll just be asking you some questions, okay?
Okay.
Hallie, do you comply with your medications, please?
Yes, I'm on this antihypertensives. I do take it every day.
Okay, Hallie, since you take your medication every day, I'm just going to encourage you to continue taking your medications, okay? The more we take our medications, the more we get better, okay, Hallie? All right, Hallie, how do you get along with activities of daily living?
Which activities of daily living do you
I mean, do you sleep well?
I think I do.
Okay, how's your toileting? How often do you go to the toilet?
Once every day at least.
Okay, once every day. Okay, Harley, that's not bad. And are you breathing well?
Yeah, I think so.
Okay, what about your nutrition? Do you eat well, darling?
Not really.
Oh,
I don't really eat well.
okay. Do you want us to refer you to the dietitian?
I wouldn't mind.
Okay, that would be great. So we can, plan your diet with you and the things you like eating most. Okay, Hallie?
That would be great.
Okay, Hallie, do you smoke? Do you drink?
I occasionally smoke.
Okay, occasionally.
Yeah.
Okay, Hallie. And do you consider quitting, darling?
Not yet.
Okay, so no problem, Hallie. That's totally your choice, okay? Anytime you change your mind, you could also get back to us, Hallie, okay? What about drinking? Do you drink, darling?
Yes, please, I do drink.
Okay, and do you consider quitting, Hallie?
I think I want to quit.
Okay, so are you happy for me to refer you?
I'll be grateful.
Okay, Hallie. Do you use sticks in walking?
No, please.
Okay, so anyway, I see you doing well, Hallie, okay? So Hallie, I will just give you some health education, okay? Because you said you had a fall, the risk associated with you is sometimes you could feel dizzy and drowsy. Does that happen to you?
Yeah.
Okay, Hallie. So please, if you want to go about doing your activities of daily living, you want to go about to the toilet, just use the call bed, darling. I will just assist you to do that, okay, Hallie?
Okay.
Do you have any concerns for me? Do you have anything bothering you?
No.
Nothing's bothering you?
No problem.
You sure about that?
100%.
Alright, Harley, that is the end of the assessment, okay? I'll be leaving you with a call bell, okay? In case you have anything, don't hesitate to use the call bell, okay? But I'll be coming back soon, you said you are having a high pain score, okay? So I'm just going to check your drug chart and see if you have an pain medication, and I'll come and give it to you. But if you don't have, I'll give a shout out to the doctor so that they prescribe something for your pain, okay? But pending on that, you want me to pop up your bed?
No, I'm fine. Comfortable.
Alright, Harley, can you play games for me?
What games?
Chat games. I'll just get you chat games to play while I get your medications for you.
Okay.
Alright, Harley. Thank you so much, darling. Okay? Bless you, okay? I'll just be back, okay?
Okay.
So, I open the curtains and the windows, do my hand like Jean, and I'll leave the patient. So guys, thank you very much for watching. If you notice any mistakes, any correction, don't hesitate to let us know, okay? And don't forget to subscribe to my channel. It's going to encourage me to do more videos for you, okay? So guys, help me say shout outs to all my friends for helping me do this video because they really made my day come true, okay? So thank you very much. Keep watching and keep correcting. Have a pass in your Osce exam. Bye.